Donating blood is important to help out patients in hospitals. Well, you may ask, why is this important? When a patient in need of blood receives blood through donation, he or she now has a second chance at life. And there are organizations who work in this area to ensure enough blood supply and products are available for patients in need. The Papua New Guinea National Blood Transfusion Services, an arm of the National Department of Health, is responsible for the management and the provision of blood and blood products for transfusion in all its blood banks around the country. Dr. Marrilyn Mathias, the manager for the PNG National Blood Transfusion Services, tells us about its role in the country.
The National Blood Transfusion Service is all about ensuring that there is blood available for transfusion for patients and ensuring that when that blood is available, the blood is safe. The National Blood Transfusion Service is a program under the Department of Health, and we basically look at ensuring that there is quality standards, ensuring that things are done properly in all the places, the blood banks in the country where blood is being collected and transfused. So we kind of overlook ensuring safe transfusion practices in the blood banks. Okay, so at the end of the day, we want patients who receive blood to have blood that is safe. And not only that, donors who come in to donate blood must, we have to ensure that their safety is okay, and even the staff safety is okay too. And at the end of the day, the patient tends to get blood that is collected properly and is screened properly and is safe. Yes. Blood banks are located in all the provincial hospitals and even the district hospitals in the country. So far there are 34 blood banks operating in PNG, POMGEN being the largest. Yep. And those blood banks are also in the private, let's say the health, not the health, district hospitals which are run by churches too. We'd like to ensure that we set up this service there so that that service gets down to the population in the rural areas as well.
Whilst these services are available for patients, when it comes to major surgeries, blood banks play an important role.
Operation that has to take place, the surgeons or the anesthetist will send a blood request down to the blood bank to cross-match the blood and hold for surgery. The reason, if there's no blood, then the surgery is usually cancelled. And because a lot of these surgeries that are done now, as much as they want to, the surgeons will in one way or another require blood. That's why blood is important to us. Most of the times I ask the surgeons, and when we do advocacies too, they come and assist us to advocate for blood donors, because they know that the procedures will take place, but most of the time we know that surgeries would not take place if there's no blood. So we'd like to advocate for blood, and many times we ask surgeons to help us to, if we go out on advocacy, to give us, certain testimonies of patients that they've done or they've assisted or managed because they needed blood and the blood was given to assist them. And many people in PNG do not understand blood transfusion and the importance until one of their very own is in the hospital requiring blood, and it's like a shock. It's a wake up call to them. They realize that, oh, my family member here, my mom, my aunt, my child needs blood, and I have to do something about it. That's the time when people start realizing the importance of blood. Blood cannot be replaced by fluids. In terms of patient management and resuscitation, giving fluids can be like, we can resuscitate a patient with fluid, but that's to a certain extent. There is always a place for blood. When there's shortage of blood, blood must be replaced with blood. So patients, cancer patients, mothers who are losing blood, um, in trauma, when there's an accident and someone has really bled and lost a lot of blood, they need blood replacement, and blood transfusion is very important. It must be given to someone who needs blood. And most of the time we encourage people, come and donate blood, because one day, or it may be you or a family member or relative that requires blood. And blood transfusion is very important. It complements medicines and other drugs. It is part of patient care. It is very essential.
With 34 blood banks in the country, the National Blood Transfusion Services is responsible for the policies of blood donation and transfusion in the country. However, many challenges are faced, and the provincial health authorities also feel the brunt of this.
At this point in time, we usually need funding support so that to come quickly, so that we can get the reagents out quickly. The reason why I say this is because every day a patient needs blood, and blood has to be available. And imagine there's no reagent. Reagent meaning reagents are used to screen the blood and test for those infections. And then reagents are also needed to cross-match. So we have to cross-match, meaning we get the donor's blood and we cross-match it with the patient so that there's no reaction. It's a term called compatibility testing. So when we see that there is no reaction, we then know that this blood is the right one for this patient. So we go according to the blood groups. So we got A, B, and O blood types. A, B, A, B, O, and AB. So these are the major blood groups. Then we have the smaller blood groups which are there. So when we group the blood, we'd like to ensure that most of the time you will know that people say, I'm blood type O, I'm a universal donor. Yes. So the blood type O is given to all the other blood groups. But the blood type AB cannot be given to O, A, and B. AB receives from everyone, but AB is a universal recipient. O is the universal donor. Yes. So we'd like to ensure that these bloods, when they are cross-matched, there is no reaction, there's compatibility before we give this to the donors. Not the donors, pardon me, the patients, yes. And because of these smaller minor groups which are also present, it's quite tricky. Sometimes the blood group is A and you're trying to give A to a blood type A patient, but there's a reaction. That's because there's some little minor groups also within that. That's why we must cross-match the bloods before we give. That's why, like I keep telling people, look, we need our reagents on time. We need funding to buy this quickly, because bloods can be collected into the blood bags, but if there's no reagent, Bloods can be sitting in the fridge and the patient is waiting, but you cannot give the blood to the patient unless we screen it and we cross-match it, and it makes it available for the patient to get. So these are some challenges we face. We bring in those staff also to the um, when we have funding, and most of the time we have partners to support us to run training, upskilling, so that when these staff go back into the provinces, they are able to do this and to ensure that they collect the blood properly and they screen it properly and give it to the donors. So all these things, we get support. We've come this far, even though we have this tough times in front of us and we're looking at the government and all this, but we do our best to ensure that at least there's blood available for a patient.
Whilst the challenges are faced every day, the team's effort in ensuring that the blood supply is constant, one area they are now focusing on is awareness on the importance of donating blood. And an important day that is commemorated annually is the World Blood Donor Day, which falls on June 14th, where awareness is made on the importance of blood donations and transfusions.
Blood Donor Day is a day that has been chosen. It was first celebrated in 2004. Not all the countries in the world, but there were some countries who celebrated World Blood Donor Day in 2004 on June 14. Now, in 2005, when the World Health Assembly met, they said, oh, why not we appoint this day as the day to celebrate World Blood Donor Day in appreciation, in commemoration of all those people who have and has been supporting us donating blood. Now, the significance of June 14 is it's the birthday of the scientist known as Carl Einstein. He's the person who first discovered ABO blood types. So in commemoration of this day and in remembrance of this person, they decided to put it on appoint June 14 as the day to celebrate World Blood Donor Day. So in PNG, we started celebrating World Blood Donor Day, I think in 2010 or 11. That was when we started with the assistance of WHO. And ever since that time, we have been celebrating World Blood Donor Day. Yes. And this is the time that we'd like to especially bring the regular blood donors in, so that different blood banks can at least do a small celebration with them and say thank you to them for being there all the time to come in and support blood bank.
In doing awareness on blood, one area the team always looks out for is the patterns of blood diseases that affect Papua New Guineans. That is why a mini health checkup is often done prior to blood donations.
There are diseases that can be transfused through blood. So this number one would be HIV. And then we have hepatitis B and C, we have syphilis. There are other diseases that we don't usually have here, but one day they may be common. So these are the 4 infections that or disease entities that we are testing now in our labs. And that's mandatory, meaning that every blood that has been donated must be subjected to all those testing, so that we'd like to ensure that that blood is cleared before we give it to the patient. One other thing also is, say if someone has HIV, or not HIV, let's say someone has hepatitis, and he comes in and he donates blood, and he's going for a procedure, and he said, oh, well, let me donate my blood, and then I can come and get that blood for myself when I'm undergoing surgery. And if we find out that that blood, even though it's meant for himself and it's donated for himself, it's a term called autologous donation. Now, that practice is, we do that also, but once we find out that his blood is hepatitis B, even though it's meant for him, we won't give it to him. We will discard that blood. That's how we have these guidelines and strict guidelines and procedures in place that we don't give blood that is infected to another person.
In Papua New Guinea, the demand for blood is high. Whilst most donate due to a family member in need of transfusion, most blood donations are voluntary. There is a need for more awareness on the importance of blood donations, as this does not only save lives, the donors also improve their blood flow and reduce the arterial blockages.